How not to die after 40. And that's a fact. Friends, look, we have therapist Neonila Linchuk with us.
But I don't feel anything. What do you want from me? The portion of blood that's pushed out during systole, when the heart contracts, causes our blood pressure to rise.
Andrei Berezovsky on the Hex Spoiler channel. As always, a channel about health. Here we're talking about a hot topic, one that claims a lot of lives. Specifically, we're talking about blood pressure.
Heart, pump. So for example, if it's just 2 glasses of wine a week,
You must not stop taking it.
unpleasant sensations in the chest, pressure, stabbing pain.
Friends, leave comments if you know at least one doctor who practices Neonil. What is blood pressure anyway? Basically, friends, it's arterial pressure, right? So what exactly is it? When we measure blood pressure, what are we actually measuring?
All right? What is pressure? We all studied physics. Well, maybe not all of us.
Oh, you started speaking Ukrainian. Friends, is this okay right now?
It would be even funnier in Russian.
I got distracted for a second, and the doctor started speaking Ukrainian. Let's do it in Russian, or better yet, in Kazakh.
Okay, all right. Everyone studied physics. Or at least attended or sat through physics class somewhere. And basically, yes, everyone understands what pressure is in terms of physics. So something presses on something else and we get some kind of number, right? In our body, there is a closed system made up of the heart and blood vessels. The heart is a pump, a kind of pump, and the vessels...
I'll translate from Neonil's language to human language. So the heart and the blood vessels. Imagine a tire tube and a pump. So the heart is the pump and the vessels are the tire tube, to put it simply.
The heart pumps and pushes out. With a certain force, with a certain pressure, pushes out a portion of blood, right? So we get the first beat or the first number, right? So, or the upper pressure or systolic, yes, systolic pressure. That's the part that portion of blood that is pushed out during systole, during the contraction of the heart from the heart into the vessels. That is, it is ejected with a certain force, yes, with pressure somewhere from 120 to 140.
The reason I'm saying this is that pressure isn't just pressure. Pressure is always, as you correctly said from physics, exerted on something. In this case, it's the pressure of blood on the vessel walls.
On the vessel walls, yes. And the second number, that's the diastolic or lower pressure, is the response of the vessel wall to this wave of blood, right?
Exactly. And now I have a question right away. Also translating this into practical terms. Am I correct in understanding that basically the upper pressure, when the heart contracts, it's actually, just imagine, let's mention our colleague Yura, so he knows we're talking about him. Yura, who has a bicycle, so when he pumps up the tire,
he presses, yes.
When he presses, that's the upper pressure. So look, the tire is inflated, and in our case, the heart system is
closed.
That is, the heart is not contracting. It contracts, then it releases. That's
diastole, it relaxes?
Yes. So basically, let's imagine that the lower pressure is when there is no contraction, meaning there is no pressure.
No pressure, but it turns out that because the vessel wall, well, in some way responds to the impact of this wave, this portion of blood against it.
Why is the lower pressure often called renal pressure?
The kidneys are, first of all, a cluster of blood vessels, right, which filter everything. Secondly, in the kidneys, there is a system with a long name, the renin-angiotensin system, which controls the tone of the blood vessels. So as soon as the kidneys don't like something, they constrict the small vessels inside themselves. This system gets activated and our blood pressure goes up. That is, yes, the lower pressure. Depends on the condition of the vessels in the kidneys, but it's not purely renal.
No.
Yes. So, yes, it does. Depend. It does. It's closely related. But to say that it only depends on the kidneys, that's not correct.
I see. What is considered normal blood pressure? Well, obviously, let's say everyone knows 120/80. What range is still considered normal?
Well, actually, in 2020, everyone sat down, discussed it, and decided that 120 over 80 is the optimal blood pressure. And there's also what's called high normal, right? That's 129 over 89.
89?
89? Yes, that's the diastolic. So, we understand that everything seems to be normal, but there are still some warning signs, right? So, with a patient like this, you need to monitor them not once every 3 years or once a year, but more frequently.
The main causes. Can you name the 3 main causes of high blood pressure? Not a one-time spike, but chronic high blood pressure.
Chronic. Well, in general, blood pressure can rise if the heart is pumping too forcefully, or if the blood vessels are too constricted, right?
Or if the blood vessels have too little elasticity.
Yes, there's meaning they're too resistant, right? The vessel wall is too rigid, so we either have some kind of heart pathology or a vascular pathology. Vasculitis is inflammation of the vessel wall, right? Or it's atherosclerotic damage to the vessel wall. When they become stiff, they can't respond properly to more blood pressure. And the hormonal background also has a strong influence. The thyroid, adrenal glands, pituitaries, and kidney pathologies. That will also play a role. But it's not just that I once had a kidney stone somewhere. Most often it's inflammatory processes, specifically in the glomeruli, in the blood vessels of the kidneys themselves, that affect blood pressure. Well, initially, we all turn to our family doctor or therapist, the family physician or therapist we work with, right? With whom.
How can a person realize that something is going on with their blood pressure and that they need to see a doctor?
Well, first of all, we can simply measure our blood pressure, right? Everyone is sitting at the table and you decide to check everyone's blood pressure, right? Then we measure our blood pressure. And for example, it's 150 over 80. There's nothing to worry about. We just make a note of it and try to systematically measure our blood pressure in the morning and evening over the course of about 2 weeks.
By the way, is there a big difference between measuring with a manual device and an automatic one?
It all depends on the quality of the device and the batteries in the automatic monitor. We, doctors, generally prefer the manual devices because you can see everything yourself and you can't blame any inaccuracies on the device. There are good electronic monitors and not so good ones, and sometimes they give inaccurate readings. Plus, they can be overly sensitive at times. In general, there's a difference between the left and, well, the dominant hand. That is, if you're right-handed, it's the right hand. Or if you're left-handed, it's the left. On the dominant hand, the blood pressure can be up to 10 millimeters of mercury higher than on the other hand. That's normal. The cuff. On almost every cuff, it's written where to attach it, where it should be placed. If we have a stethoscope at home, we use it to listen. First, we pump it up to the mark, somewhere around there. Well, unless we have very high numbers like 180 or 200, because going higher can simply be uncomfortable for the person, and because of that, their blood pressure can reflexively increase due to the pain. So, we inflate it and slowly release the air, listening for the first and last sound we hear. In this way, we get the upper systolic and diastolic blood pressure readings. According to the rules, our cuff on our manometer should be at the level of our heart. That's it.
And what is it for? What if we get a high blood pressure reading?
125. And the last time at the 85.
According to the Geneva Convention.
Yes. Ideally, we should measure it 3 times.
And take the average?
Well, yes, somewhere between the second and third readings. We should pay attention to whether we have any complaints during this increase in blood pressure. If we don't feel anything, yes, our blood pressure went up once, but that's it. Blood pressure is not just a single number. We can't have 120 over 80 all day long. There is an examination called ambulatory blood pressure monitoring. It's actually the gold standard for diagnosing hypertension.
Let me know. Has anyone here ever done a 24-hour blood pressure monitoring? Holter. That's Holter, right? Holter, actually, friends. Not ECG, but blood pressure. By the way, if you're interested, leave a comment and we'll make a video about it. Of course, I'll put it on myself. I'll take Neonila and I'll wear both the blood pressure monitor and the whole to myself.
If you have frequent nosebleeds, for example,
Bleeding?
against this background, if we experience any unpleasant sensations in the chest when blood pressure is elevated, pressure, stabbing pain, a feeling of palpitations or irregular heartbeats.
And what about increased heart rate itself? How is that related?
People like me, well, that's compensatory, yes. It turns out the higher the blood pressure, the more often the heart has to pump to compensate and prevent anything from rupturing. That's it. So, discomfort in the heart area. Dizziness is common, as well as nausea and headaches. Yes. The pain is more often in the back of the head, but that's not always the case. In general, headaches should be examined. We definitely need to see a doctor. Don't wait 2 weeks. Don't just keep measuring. Just go to the doctor and say, I've had this kind of blood pressure and these symptoms. Hassas. Please, let's figure this out. Because when everything is fine and our body is adapted to this blood pressure, we can measure it and observe, yes.
Look, but am I right in understanding that when the arteries lose their elasticity, it's easier for cholesterol and similar substances to get in, and that's how these cholesterol plaques and so on form?
Well, cholesterol plaques themselves make the vessels stiffer. A plaque isn't just, a little flat thing lying there. It's a process where cholesterol seeps into the vessel wall, yes. So it's not just some little clump somewhere.
All right, let's do it right away. Right away. Let's do it. If a person lives with high blood pressure and does nothing about it, Neve, what can that lead to?
Heart attack, stroke.
So all of these...
Yes, and these are called target organ damage.
In general, the story about blood pressure, it seems to me, is a story about fast, about slow. That is, blood pressure increases slowly over time in a person. And in fact, working with blood pressure, whether with medication or something else, is also a slow process. So messing around with drugs that sharply lower blood pressure is also not allowed because it can be dangerous, as I understand it.
About blood pressure. Actually, situationally, blood pressure can rise and fall quite quickly in the body because it's a compensatory mechanism. If we need to run away from a tiger, that means we need higher blood pressure, so it will go up. That's how nature designed it. Hypertensive disease develops gradually. Most often, patients with high blood pressure say, but I don't feel anything. What do you want from me? My normal working blood pressure is 180/100. Leave me alone, okay? Because the body gradually, quietly adapted to it. It got used to it, it lives with it. The point is, any system has an expiration date, right? It can work at 200, but not for long, or at 120, for example, but for a long time. So the whole idea is about how long we want to live and how good we want that life to be. Because, for example, you can also live a long time after a stroke. But believe me, that's a very poor quality of life. I vote for trans fats. Yes, those are tasty fats. They're the tastiest, yes. These are fried, specifically fried, heat processed animal fats, yes, and even vegetable fats. Salt, so excessive salt intake.
Retains water.
Yes, it retains water.
Accordingly, the heart has to pump more.
Our circulating blood volume increases. Yes, we have to pump all of this, but it's not just retained in the blood vessels, it also accumulates in the tissues. Nutrition should be adequate. I want to say that you can't just call salt, pure evil or anything like that. Everything in moderation, everything used properly is beneficial.
How does alcohol affect blood pressure? Why do some people say, for example, that wine lowers?
It dilates the blood vessels.
And what about cognac or something like that? Do they have the same effect or not?
Well, in general, alcohols relax the blood vessels. They dilate them. This lowers blood pressure. But the whole point is, for example, it's the same old story, the same conversation about moderation. So if it's a glass or two of wine a week, that's fine. It doesn't affect anything. It has an effect on good mood, good digestion, and lowering cortisol levels. That's one of the adrenal hormones. It's the stress hormone. First, in any guideline, in any protocol you look at, in any recommendations you check, the first big, very important, but also very difficult point is lifestyle modification.
I agree.
That's something that works slowly but very effectively.
By the way, how much time do doctors usually give for this? 3 weeks for modification.
3 months, sorry, 3 months.
Friends, you have 3 months. Even if you currently have high blood pressure, lifestyle modification involves several approaches. And I can definitely list them. A, that's a more active lifestyle, adding exercise. B, naturally working on your diet. Smoking, alcohol, that's C. That's basically it. That's the whole modification, really. The recipe is clear, everyone knows about it, but no one actually does it. That's it.
Await a pill.
Yes, everyone is waiting for a pill. When it comes to pills, the situation is complicated. Am I right in understanding that the idea of Vasya takes this medication, so I'll start taking it at the same dosage? That just doesn't work at all, especially with blood pressure.
Well, to begin with, if you go to the pharmacy and just pick up something for blood pressure, in principle, they'll at least recommend something that's typically prescribed as a standard for initial treatment, maybe even sometimes under a doctor's supervision. What are the risks? The risk is that we've chosen the wrong dose. We might have chosen a medication that isn't suitable for this particular type of arterial hypertension because they're a bit different and have different mechanisms. Every medication has its side effects.
I think that an incorrectly chosen dose won't have any effect, except for causing blood pressure spikes, which is risky.
Which is by the way, blood pressure spikes are the most unpleasant thing for the body because it doesn't like. There's nothing worse than living through a period of change, right? And the body can adapt to high blood pressure, but gradually, or to low blood pressure, but gradually. But when it's up and down, the heart has to pump faster, then slower. The blood vessels have to either expand or constrict. This is fraught with the risk that we are, more?
Friends, what is it fraught with? Thank you, Mila, for that. Look, once again, it's like birth control pills. You can't just stop taking them. That's the first thing, because it can lead to blood pressure spikes even if you suddenly feel fine, and even if your blood pressure is normal. If you're on therapy, you still need to take your medication, because otherwise, again, it can lead to blood pressure spikes, which, as the doctor says, can be fatal.
This pain, this wears out the blood vessels and the heart even more, and increases our risk of strokes or heart attacks.